দেবীপক্ষ শুরু হয়ে গেছে। আর দেবীপক্ষ মানেই নতুন জামা কাপড় পরা, নতুন চিন্তাধারা, নতুনভাবে এগিয়ে যাওয়া আরও এক বছরের জন্য। আর আমরাও আপনাদের জন্য নতুন কিছু হাজির করার চেষ্টা করছি। আর সেই হাজির করার জন্য আজকে আমরা এমন একজনকে পাশে পেয়েছি যার বা যে প্রতিষ্ঠানের নাম আমরা অনেকেই শুনেছি। সেই প্রতিষ্ঠানটির নাম চেন্নাই অ্যাপোলো। দক্ষিণ ভারতে চিকিৎসা করাতে যাননি এরম মানুষ প্রায় এখন অনেক কম। আজকে আমরা সেই দক্ষিণ ভারতের অর্থোপেডিক সার্জন, বিশিষ্ট চিকিৎসক ডক্টর কোনার্ড পি কৌশিগানের কাছে হাজির হয়েছি। আজকে আমরা আলোচনা করব যে জয়েন্ট পেন, যে বিভিন্ন পেন বা হাঁটু রিপ্লেসমেন্ট বা কখনো গাঁটে ব্যথা, কি করা উচিত কি করা উচিত নয়, এইসব নিয়ে। তবে যেহেতু তিনি একজন দক্ষিণ ভারতীয় চিকিৎসক, সেই কারণে আমরা এই ভিডিওটি ইংরেজিতে তৈরি করেছি।
Namaskar, good afternoon. I am Dr. Konark Kosigan, Senior Orthopedic Consultant at Apollo Hospitals, Greens Road, Chennai. I specialize in joint replacement and sports surgery at the Apollo Group of Hospitals.
আজকের বিষয়
one of the common conditions which causes pain and difficulty with day-to-day activities of a person affecting the joints is arthritis. There are various forms of this arthritis. Now the end stage of this arthritis could have damaged the joint to such an extent the joint becomes almost continuously painful and the patient has difficulties even with simple day-to-day activities. In that stage of the joint involvement, one of the treatment options is replacing the joint with what we call a prosthetic joint or an artificial joint. Now the commonest joint replacement surgery the world is known is the knee joint replacement, hips, shoulders, and virtually, yes, over the years I've had the opportunity to get trained and replace almost even small joints such as the finger joints. But the common among them is the knee, hip, shoulder, and ankle. When we talk about joint, it is formed of bones, the cartilage, the ligaments, and the supporting muscles around it. So whenever someone has an injury to the joint or presents with a symptoms involving the joint, the commonest symptom is pain. And as I told you, the joint also has cartilage and ligament. They can also present with the swelling in the joint, or the other common thing is they say the joint feels unstable, that they cannot trust the joint. It feels like it's going to buckle or give way. So pain, swelling, instability, and other main thing which sometimes people come worrying about is the joint makes noise, the clicking noise, or the joint gets locked sometimes and takes some time to free up. And then we have to identify what is the cause of this joint pain, from where it is arising. And we look into those four major components of the joints. talking about arthritis. Now, while osteoarthritis, which is gradual wear and tear and degeneration of the joint, leading to pain and loss of function in the joint, is a condition involving people of advancing age. It is not uncommon to find arthritis even in children and adolescents. One of this is known as juvenile adolescent inflammatory arthritis, and a common among them being rheumatoid arthritis, and it can run in families. Now, of course, in terms of injuries, either sports related or non-sports related, such as work related accidents or road traffic accident, can happen in any age group. Fortunately, most of the pain may be temporary, so if the patient can recognize the pain as happened following a specific activity or injury, what they normally do is to rest it for a couple of days, ice it, and see if the pain or any other symptoms from the joint settles. If the pain persists and does not settle with simple measures, and more importantly, even if the pain is there at rest, I would recommend that they see an orthopedic specialist. Now, some of them may first approach a physiotherapist also, but you need to have a diagnosis for the pain to pursue with certain forms of therapy. Now, when you go to the orthopedic surgeon, then he or she may then direct as to what would be the next logical step. It may be a symptomatic treatment and physiotherapy with medications. It may be in the form of medications, splinting and modifying the activities, or, like you rightly said, as some of these conditions may be related to inflammatory arthritis or the similar conditions, the orthopedic surgeon then would refer you to a rheumatologist or a physiotherapist. Now, if you have a strong family history of rheumatoid arthritis, ankylosing spondylitis, and some member of the family are already under treatment with a rheumatologist, you may first go to the rheumatologist. Even that would be fine, because if that particular joint condition needs any surgical intervention or any other form of therapy, he will refer to the orthopedic specialist. But primarily, if it is a sudden onset joint related issue, if it's not settled with basic measures, I would suggest please do consult an orthopedic specialist. South India, and particularly Chennai, is for a long time known to be a hub or a very renowned place for several renowned educational institutions, several renowned training institutes, and that goes hand in hand with also having produced many excellent doctors and specialists in various fields. Now, one is the availability of many multi-specialty hospitals, across the globe and across India. But the more important thing is the availability of multiple specialties with experienced faculty under one roof. And I think that is a very important factor in being able to provide a very comprehensive and holistic care to the patients. Because quite often it may not be a single surgeon or a single specialist being able to treat a specific condition. You need to have a multidisciplinary team to handle particularly certain complex situations. And fortunately, we are blessed with that at the Apollo Hospitals in Chennai. And it is not only in the recent years. Chennai is known to have very renowned specialists in various fields for many, many years. And I think you also mentioned not only from India, it also from various parts of the world. Again, the foremost thing is the expertise we have and the ability to match international standards, if not in certain situations, even provide even better care or having the competency to handle even far more complex cases. And to be able to provide all this at a much cost-effective manner if you're going to compare to the West and other countries. So it's a combination of expertise, excellent infrastructure facilities, state-of-the-art technology to be able to deliver even high-end surgical procedures, and to go with it, the availability of all the disciplines under one roof with good experience, thereby able to deliver this multidisciplinary care to the patient.
অসংখ্য ধন্যবাদ ডক্টর কুনাল পি কৌশিগানকে আমাদের সময় দেওয়ার জন্য।
I hope some of the information already I could share with you would be useful for all of you in taking care of your bone health and your joint related issues. Certainly feel free to approach Meditips for any further clarification or any of your questions unanswered in future. I would be happy to oblige and share my experience and give my advice to you.
ভিডিওটি ভালো লাগলে অবশ্যই শেয়ার করুন এবং সচেতনতা বাড়িয়ে তুলুন। আর হ্যাঁ, যারা মেডিটিপস ইউটিউব চ্যানেলটি এখনও সাবস্ক্রাইব করেননি তারা সাবস্ক্রাইব করে নিন আমাদের এই ইউটিউব চ্যানেলটি এবং পাশে থাকা বেল আইকনটিকে প্রেস করে দিয়ে অল বাটনটিকে ক্লিক করে দিন। আর শেষ করবার আগে সমস্ত বিজ্ঞাপনদাতা, সমস্ত দর্শক বন্ধু সকলকে জানাই শুভ শারদীয়ার প্রীতি, শুভেচ্ছা ও অভিনন্দন। এই ডাক্তারবাবুর সঙ্গে যোগাযোগ করতে বা কলকাতা সহ ভারতের চিকিৎসা ও বাণিজ্য সংক্রান্ত যে কোনো বিষয়ে সহায়তার জন্য যোগাযোগ করুন আমাদের সঙ্গে এই ঠিকানায়। আমাদের ফোন নাম্বার +91 9330 240 762। আবার বলছি +91 9330 240 762। আমাদের ইমেল আইডি mailmeditips@gmail.com। এছাড়াও মেডিটিপস নামে ইউটিউব ও ফেসবুক পেজেও পাবেন আমাদের।